The CDC is asking doctors nationwide, especially pediatricians, to be on the lookout for and report any cases of a strange new disease they may come across. It is a rare but serious condition affecting children that appears to be linked to COVID-19. CBN medical reporter Laurie Johnson joins us now for the details. For so long, Laurie, we have been talking about how this virus, this pandemic, hasn't been hitting kids. Is that changing?
Well, it might be.
Yeah.
And so we don't really know how much of a connection there is with this PMIS disease and the coronavirus. We know that is, for parents need to remember, this is very rare. So far, only 150 children have contracted it, 3 deaths. 18 states, most of the cases have been in New York, and most of the children have had a coronavirus or have it now, but not all. And so that's why the CDC wants doctors to report these cases, because they want to take a look at it and see how much, if at all, it is associated with coronavirus. What we're seeing in these kids is the immune system overreacts, and we're seeing this come on like about 4 to 6 weeks after a possible infection. And we know that when the immune system attacks the virus, that's a good thing, but sometimes it goes too far and ramps up too much. They call it the cytokine storm. We've seen it in adults with coronavirus, and it actually, then the immune system start attacking the body. And so things like the heart and the kidneys, blood vessels, things like that.
Okay, so tell us, what are some of the symptoms that folks should watch for? The
main thing is, and all of these symptoms are they need to persist for at least a day. So we're talking about things like fever, also irritability and sluggishness, unexplainable abdominal pain, diarrhea and vomiting, and a rash or conjunctivitis, which is pink or redness in the eye, and then enlarged lymph nodes. Lymph nodes are the little glands on the side of the neck, and then red cracked lips and a red tongue, sort of looks like a strawberry, and then swollen hands and feet, and the swollen hands and feet could also be red.
Okay. Is this contagious?
This particular PMIS is not contagious, but of course coronavirus is contagious. And if this is coming on because of the coronavirus, then that's where the contagion lies. And so children, of course, like all of us, are being asked to be especially vigilant with hand hygiene, washing the hands, and social distancing where possible.
Okay, real quickly, how can you get treated?
Well, unfortunately, this is a very serious disease. We see a lot of the children ending up in ICU, and they're being given IV immunoglobulins to kind of tamp down that immune response. This is a lot like Kawasaki disease or toxic shock syndrome. So the treatments for those 2 diseases are being used on kids with this.
Okay, terrific. Laurie Johnson, as always, thank you so much for coming in.